Hi, Grandpa. I just dropped by to see if you needed any help around the house.
Oh no, my neighbor Joe's helping me with everything around here. I am gonna go outside soon though and fill up that bird feeder.
I'm really glad you can enjoy yourself in retirement, Grandpa. I do have one question, though. Grandpa, how have you been feeling lately?
I've been feeling so good I actually just started taking my medications every other day instead of every day. I figure why take my sugar pill every day if I feel great, right?
What we just witnessed was a very common scenario in real life. The patient was not taking their medication because he felt good, or in other words, he was asymptomatic. When a patient misses a dose of the medication, the blood sugar might spike up, and the symptoms of high blood sugar are not always so obvious. They might include being very thirsty, so the patients could think to themselves, hey, it's just a hot day, I just am drinking more water. It's common. The other symptoms of high blood sugar might include infections or wounds that just may take a while to heal. Blurry vision is also another symptom, which can be mistaken as age-related vision loss in our elderly patients. Low blood sugar can also occur due to non-adherence or non-compliance with the medication. Say if the patient realizes in the evening that he missed his morning dose and he wants to just take the morning dose together just to compensate, that might lead to having the blood sugar go down. The symptoms of low blood sugar might include like dizziness, being hungry, excessive sweating, trembling, shakiness, irritability. So even if the patient may feel okay, the blood sugar might not be ideal at that given point. So skipping doses and allowing the sugar level to rise can lead to many consequences. Some of them include vision loss, poor kidney function, and high risk of infection. The term for not taking a medication according to doctor's recommendation is called medication non-adherence.
Grandpa, remember, Dr. Moy said that even when you feel okay, you need to check your sugar and make sure you keep taking your medication correctly. We really want to be sure you don't run into trouble later on with vision or your kidneys. Remember, these are things you may not feel getting worse day to day, but over time they can gradually be affected by high sugar.
Now that you mention it, I do remember talking about that. Well then, I need to tell you something else, son. I haven't refilled that one medication that starts with an M since I ran out. Maybe I'll head over to the pharmacy now to get it refilled. Man, I feel like they moved that counter farther away this time. Geez, it's a little bit harder to see things nowadays. Geez, I wonder if they were right about that adherence thing. Man.
Hello, Mr. Smith. My name is Alex, and I am the pharmacist here today. What can I help you with?
Hi, yes, I'm here to pick up my medications. Also, my daughter mentioned that I should get some vaccines due to my conditions. Can you tell me what vaccines I should get?
Yes, I can definitely help you with that. Let me take a look at your file to see what you are eligible for. Okay, Mr. Smith, based on your file, you are eligible for the annual influenza vaccine, shingles vaccine, and potentially Tdap. Oh, and pneumococcal vaccine. I know that sounds like a lot, so we can go at a pace you feel most comfortable with.
Oh wow, that's a lot. Maybe you can give me some information about those vaccines.
Of course. I printed some vaccine information sheets for you to look over as well. So let's get you started on getting you up to date on your vaccines.
Well, thank you kindly. I appreciate all your help through all this.
Absolutely. We are always happy to help. Adherence is not just making sure that you're staying up to date on your oral medications or your inhaler medications, but it also applies to making sure you're staying up to date on your vaccinations. The CDC provides a very helpful schedule so that you can follow to stay up to date on those vaccinations. Making sure that patients are staying up to date on their vaccinations helps them to protect them and keep them healthy and out of the hospital. For example, some of the vaccines that are offered at pharmacies include the influenza vaccine, the shingles vaccine, pneumococcal vaccine, and Tdap, just to name a few. The flu vaccine is recommended annually, and it is effective if gotten right before the months of flu season, which occur between October and April. The shingles vaccine is recommended for patients that are 50 years and older, especially if they've been diagnosed with chickenpox in the past. This includes a 2-dose series that are given 2 to 6 months apart. They are also recommended for patients that are 19 and older with certain risk factors and should be discussed with your pharmacist or provider. The Tdap vaccination is recommended every 10 years, and the pneumococcal vaccine is recommended for all individuals that are 65 years and older, or for those that are younger than 65 and have certain medical conditions that can be discussed with the pharmacist and or provider. All vaccines eligibility should be discussed with your doctor or pharmacist to make sure you're staying up to date on your vaccines. Okay, so I just wanted to share briefly with you all a helpful tool that will help you make sure that you have your medications on hand and making sure that you're staying up to date on them as well, and can be useful for vaccinations and over-the-counter medications you're taking. So here we have a list that you can write out, and here you can write the medicine that you're taking, what I take it for, the start date, the refill date, how much do I take, so 1 tablet twice a day or once a day or however you take it, and then when do I take it. So this is just a very helpful tool that you can write your whole medication list so that you can follow and make sure that you are calling the pharmacy at the appropriate time to make sure that you're refilling it on time. And if you're unsure of anything, you can always call your provider or pharmacist, and they have a list of questions here. So I'll just read for them briefly. So what's my medicine called and what does it do? How and when should I take it, and for how long? What if I miss a dose? Are there any side effects? Is it safe to take with other medications or vitamins? Can I stop taking it if I feel better? So these are all questions that your pharmacist or provider should know and can provide you with the appropriate answers so that you're taking your medications effectively, on time, and efficiently that helps you the best. And this can be stored right into your wallet so that you can have your medications on hand at all times so that you know exactly what you need and how to take it.